guys, Jonathan here. I started my new job today and pretty excited. It's my first day in palliative care. I'm going to be doing it 5 days a fortnight for the next year. It's August the 8th today and I had my first day and I wanted to vlog. I found the benefit in doing something every day and getting better at it, and I would like to do this for a year. I know it's a bold move, but I'm not going to break the chain. I'm going to keep on doing it after every day. Just reflect on what's happened. 5 minutes talking about things that I've learned, things that I can teach you about palliative care from the primary care perspective, but also the specialist perspective. You can hear the people in the background, kids having dinner. I'm going to go join them. I'm tired. It was a long day. We had a couple of family meetings. And the biggest thing about palliative care, and I remember doing a placement last year, and a wise palliative care doctor said that the questions don't get any easier. We answer hard questions in palliative care about death, dying, and end-of-life decisions, but you become better at going through the process and asking the right question. And that right question usually is a balance between what is in the best interest for the patient, and that's where doctors can weigh in, and what would the patient want? What does their personality and values and what does their risk profile allow them to make that kind of decision? And that's, I guess, what I learned today. Reflected on, we had a woman with delirium who's making a big decision. She's got renal failure and she's making a big decision about her end of life and where she wants to spend her last number of weeks to months. And we had a really productive family meeting. It went for a little while. And I think the biggest thing I want to do with the vlog is to really capture my progression and to look back and go, wow, those vlogs really sucked. But this one is special because I feel called to doing palliative care, being a doctor, because I think palliative care doctors are wise people, because we're helping people make decisions at the end of life. We are having to listen to opinions and provide guidance in amongst the turmoil that could be happening. And I think that it is something that I'm really considering, because I love wisdom. It's something that I pursue. I read. This is what I'm reading about. It would probably be flipped up the other wrong way, but this is the Passion Translation, Proverbs and Psalms. And I feel that as a doctor, moral compass, people use this term about moral compass, and everyone has their own. And I think it's the North Star. And mine is God. And it's Jesus who died on the cross. And I'm a Christian. I believe that Jesus and the Holy Spirit lives in me and leads me. It sounds a bit weird for anyone who's a non-Christian, but that's my North Star. I always come back to that and I pray through the day. I'm not a Bible basher. I'm someone who's very accepting about lots of different things. So I think the biggest thing I've learnt today is that we need to ask the right question when someone's dying. Today, I think the question that the patient was wanting to ask, and the right thing was, where is the safest place for her to die? And that was something the family needed to come to terms with. We also learned a little about cannabis, and in summary, really the evidence that we have presented to us as doctors and as health professionals isn't strong. There's a high amount of bias in a lot of the literature. So a vast array of different types of cannabinoids being used, blended mixes of different compounds, synthetic, THC, and I can't remember, but different mixes. And so the evidence isn't strong, but there are certain studies that show, there's one that was presented that showed significance. There are a couple of compounds that are available in Australia, went through the process. It needs, in Western Australia, needs to go through the WA Health, through the CEO. There needs to be a reason, there needs to be a management plan, there needs to be safety and efficacy plan around it. And then you're granted special access to the drug. At the moment, it's really specialists, neurologists, rehab specialists, and I think palliative care doctors can also get access to that. From a general practice point of view, what will I be telling my patients is that there's not a lot of great evidence around it about the topical, the oil, the tablets, the spray, all the different ways of taking it in. I'm not opposed to cannabis use if it helps chronic pain and it helps nausea. Personally, what I would be recommending to my patients is that you get it, you use it whichever way you want to, but it's not something that I would actively pursue as management for your condition, be it chemotherapy-induced nausea, intractable epilepsy, multiple sclerosis, and different things like that. You can hear now the baby's coming in, and that's probably my signal to end my vlog for my first day in palliative care. Hope to see you soon.